All right. Hello. Thank you for joining us today for our webinar, Intersections of Care, Healthcare, Hospitals, and Environmental Justice. I am sorry I didn't have any elevator music for you while you were waiting so patiently, but we'll work on that. So here's a little rundown of what we're going to be doing today, what we're going to be talking about. First off, my name is Tyler McDaniel. I am the Environmental Justice Program Coordinator with CEDIK, the Community and Economic Development Initiative of Kentucky. In my role, I provide technical assistance to communities around the state for their environmental issues and environmental justice concerns. So that can be identifying funding streams that might work for a certain community or sector. It could be helping them navigate those processes of the application itself, and then the pieces afterwards. It could be providing community engagement and outreach support, facilitating meetings, connecting people to new ideas and resources, and then also just kind of that resource piece broadly of connecting folks to resources around the state, funding other people doing the same work, network building, things like that. So I appreciate y'all being here today to explore some of these environmental issues with me. So here's sort of an outline of what we're going to be doing today, talking about what environmental justice is, what social determinants of health are. We're going to be talking some areas of impact, screening tools you can use to kind of sort through some of these things, case studies, some next steps, some resources. We're covering a lot of ground today, and it's going to be a lot of information. So I might sort of breeze through some of it, but the slide deck is loaded down with links and with information, and hopefully will be a really good resource for after the meeting for you to explore and really dig in deeper to some of this information. Also joining me today is my colleague, Melanie Nall. Some of y'all might know Melody, sort of a wizard of our hospitals and healthcare realm. So, any questions that I can't answer specifically about that, hopefully Melody can get those. We are using this Zoom workspace format, so it's a little bit different than the typical Zoom experience, but there should be kind of a chat box, a Q&A section where you can throw any questions. So if anything comes up during my presentation, feel free to throw that in the chat and or wait till the end, and hopefully we'll have some time to talk about it. All right, well, let's get going. So to begin, we'll talk a little bit about what environmental justice is. Now, this is a very big sort of official definition, and I will read this to you, but I will not read every single slide of this presentation to you. Um, but for this definition, environmental justice is the fair treatment and meaningful involvement of all people, regardless of income, race, color, national origin, tribal affiliation, or disability, in agency decision-making and other federal activities that affect human health and the environments, so that people are fully protected from disproportionate impacts and adverse human health and environmental effects, including risks and hazards, including those related to climate change, the cumulative impacts of environmental and other burdens, and the legacy of racism or other structural or systemic barriers, and of equitable access to a healthy, sustainable, and resilient environment in which to live, play, work, learn, grow, worship, and engage in cultural and subsistence practice. That is a very long sentence, but that is the federal definition of environmental justice. Now, sort of to break down a little bit more what all of that means, um, it is essentially kind of a people and community first approach to working in the environment. Now, environmental justice is sort of thought to begin in Warren County, North Carolina, back in the 70s and 80s when there was going to be the dumping of soil that was contaminated into a nearby landfill. Now, of course, environmental impacts go back a lot further than that. But this happened on the edge of a predominantly black neighborhood, and the residents sort of rallied together and protested the dumping of the soil into the nearby landfill, talking about how they didn't have any decision-making power, how no one talked to them about what happened, anything like that. So like I mentioned, we know this goes back a lot further, right? That especially even people around Kentucky have been faced with environmental impacts for a really long time as well, and that those often kind of intersect with some of our industries and other things. But once again, environmental justice being a people and community first approach. And it particularly focuses on the idea of disadvantaged communities. And that can just be people who are not typically represented or having the means of being well represented, groups like the elderly, like young people, low income communities. So sort of the definition of environmental justice has expanded outward a lot to include a lot more people. And within that, once again, decision-making power and the idea back to that original definition of fair treatment. So no group being like more affected than another, right? So this group in a low income area should not be considered less worthy of a clean environment than people in a high income area. So essentially, everybody has the same rights, the same protections, the same policies, and the same power to shape their communities, and that their voices should hold the same weight. Now, some of the other pieces within this, the disproportionate and adverse impacts section, and when we think about what those adverse impacts are, we kind of talked about disproportionate a little bit with that example of low income, high income. But this is kind of where we start to get into the social determinants piece, where we think about the ways that environmental health or environmental impacts, human health, climate impacts, all these different things start to kind of to blend together. And we start to see, once again, those lower income areas, if there's a landfill beside it or a factory, that they may have greater pollution burdens that then may result in greater health impacts. And some factors that may indicate those disproportionate and adverse health impacts can be any of these things here. So once again, the proximity and exposure to those hazards, kind of getting back to this piece of elderly folks, of younger people, kind of the two groups that we think of as being the most susceptible to chronic medical conditions, to health impacts broadly. And then also just expanding outwards as we once again think about those social determinants of health, lack of access to things like health care, living in food deserts, not having adequate transportation, adequate housing. And then as we start to think about the social determinants of health, and I'm sure all y'all, or most of y'all, are familiar with that concept and what those are. And there are generally considered to be five, arguably six of these at the moment. And those are sort of defined as these non-medical factors that influence our health outcomes and our livelihoods. So conditions where people are born, live, work, play, worship, and age. So there's a wide set of measurements for how we kind of look at these things. So they can be determined by socioeconomic status, education level, access to healthcare, access to food, and sort of some other kind of neighborhood variables. Access to parks and green space. Once again, access to transportation, access to you know, uh, transportation also not only for cars, but for walkability, right? Sidewalks, um, ways that you can navigate your place. And I think essentially, these are all rooted in the ideas of access, affordability, and proximity. So kind of keeping that in mind of do you have access to something? Is it affordable? Are you close to it? And these are sort of the six widely considered social determinants of health: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and food security. So when you start to think about these pieces of the social sphere and our places, and then you start to stack some of these environmental concerns on top of them, is when we kind of start to get into the environmental justice realm, and start to think about how these impacts can sort of tie into one another and you know, start to really stack up and influence a place. Like I mentioned earlier, that idea of health impacts from a community that is by a factory, or potential pollution from soil, potential soil pollution from a landfill, or from uh, a nearby, like a coal mine or a factory or anything like that, or even just proximity to a lot of like trucks and a lot of high traffic area. And you might see some of that diesel impacting folks' air quality, impacting their soil quality, and those sorts of pollutants stacking up to the neighbors in that way. And then are there nearby hospitals, for example, which we'll talk about a little bit later in one of the screening tool examples, as in a lot of rural areas throughout the state, there might not be a hospital in the county. You might have to travel a little further to go to a hospital. But then if you don't have adequate transportation, how do you get to that hospital? So that's how we can start to see the social determinants of health kind of stacking on top of one another. And this is just a graphic that I really like, and thought that it kind of ties into all of this as far as the social determinants of health, and sort of thinking about extreme weather and climate change, and how these aspects of the environment can then impact other pieces like water quality, like air pollution, and what those things can lead to, and sort of the ways, once again, that these things reverberate outward. So now that we've kind of defined that a little bit, these are kind of the main pieces that we're going to be talking about coming up. Um, some of these impact areas that people are pursuing, and how they kind of meet and confront these things. Ideas of nature-based prescription models. We'll talk about hospitals and healthcare centers as climate resilience hubs, rethinking and implementing community health, and the sustainability of the buildings, the products, the medicines, the spaces broadly. So this is where we're going to we're going to touch on some case studies about how various places are tackling these things. And within each of those case studies, there are extra links, hyperlinks for when you have the slide deck. So if you want to read more about those, you can. So sort of thinking about this first way of meeting some of these things, this idea of nature-based prescriptions. And this, of course, all these things require some partnerships and some rethinking of how we might approach our industries and our spaces and all these different things. So for the nature-based prescriptions, this idea that doctors can prescribe not just medicines to alleviate concern or health care concerns, but can also start to prescribe time in nature, or potentially like volunteering to alleviate these some of these larger kind of things like anxiety, depression, the loneliness epidemic. A doctor might prescribe X amount of time at a certain volunteer organization per week. And some of these studies and articles over here on the right, as you can see, they suggest that these things are impactful and that they work. And these articles also illustrate the effectiveness of reducing these things like anxiety, depression, loneliness, but also show improvements to cardiovascular health, to mental health. So you really start to see the broader impacts and of being in nature, of being around green space, and the ways that it can soothe and calm. And there's also consideration within this of the local perceived environment. So that gets into the social determinants of health as well. When we think of the amount of green space in an area, are there parks in an area? Um, green space not only within parks, but also, are there trees? Are there bushes? Is there sort of a big biodiversity in the area? And what are the other physical and social factors of those places? Is there a lot of litter? Are people exposed to higher rates of crime? Is there not access to good food, and how those sorts of the ways that we perceive our environments and what that does to our internal stressors and internal anxieties. And when we get outside of those and begin to kind of rethink and with some of these nature-based prescription models, that some of those impacts to mental health can lessen rather. And now, before we move forward into some of these other case studies, I want to just define some of these terms that we're going to be talking about. Uh, we're going to be talking about climate resilience and climate resilience hubs, and this idea of climate resilience and how communities can anticipate, prepare for, respond to, sustain climate-related disasters and events. Of course, we unfortunately in Kentucky have seen quite a few of those over the last few years. The tornadoes and flooding in western Kentucky, the flooding in eastern Kentucky, um, and predominantly those two regions of the state, but how communities can meet and respond to those. And this idea of hubs as far as how can community spaces better equip themselves to be responsive to those things, and what can they provide in those moments of being prepared. And there you see some of the services in these areas right here. Those can be phone charging places with electricity, when electricity goes out broadly, cooling centers and extreme health events, places to distribute and organize based those around those delivery services and based around whatever the needs are, So delivering food, things like diapers, allowing for showers. Um, and also, we're going to be touching on just sort of the broader impacts of these activities as we see listed at the bottom. These things can lead to cost savings and energy conservation. Once again, tying back to the nature-based prescriptions by increasing green space, food systems, and sustainability. So, really going to be thinking about a lot of these things as playing into these larger systems that can influence our social determinants of health. And a few more. Sustainability. So, striving to meet the needs of the present while ensuring that the needs of the future generations can also be met. So, sustainability, it can be thinking of sustainability for structures like healthcare centers, hospitals, and the energy they use and how to make those more efficient. But we also want to think about sustainability in regards to people's health and happiness, and their way of life and community. And there are there are considered three main principles of sustainability, which are environmental, social, and economic. So thinking about how can we make all three of those, things that are highly effective in the present and ensure the community's health around the environment, around their social interactions, around their economic wealth and health into the future. And then nature-based solutions are going to factor into a lot of these examples. And those are they're like sustainable features, implementations that they include natural elements like listed here, plants, rocks, trees, and landscape, but they often address environmental and social issues. So, in some places you might see these in areas that have a higher, steeper hillside, you might hear about things like riparian buffers and the way that these things like native plants and then trees can factor into flood mitigation, how they can work with water retention, and water runoff and water quality. Of course, trees reduce the urban heat impact, and using that phrase urban heat broadly, just to think about like concrete spaces and the heat of exposed spaces, where things can tend to be a little more dense. But also they do things like they protect our places, as in our cities and our downtowns, but also our wetlands, and our farmlands, and utilizing things like green sinks, and other places for water runoff that can alleviate concerns like flooding and um, higher rates of erosion and things like that. And nature-based solutions often combine with green space. So, a couple of, as we get into the case studies here, thinking about the stressors that climate-related events can cause on communities, and particularly hospitals and healthcare centers. So, the example here that I have up top, extreme heat requires more cooling, uh, both for your buildings, but also for the community at large, which puts more stress on the power grid and can lead to outages. And of course, hospitals are often equipped with backup generators and things like that. But to sort of add this extra degree of protection in extreme health events, we might think about this idea that we're kind of seeing in communities around the country, like installing solar panels, or micro power plants, and having these kinds of backup battery centers where the buildings can store energy in case of outages. And there are a couple different approaches to that as well, to that energy storage. Here on the left, you see this example in Omak, Washington, where this facility, this family health center, put solar panels on their roof and their carports. So thinking about not only solar panel on the building, but also thinking about solar panel where people park, uh, over parking lots, which tend to just be gigantic swaths of concrete that attract lots of heat, and sunlight because there isn't a lot of cover there from trees. So sort of using solar panels in those spaces not only to collect energy, but also to cool the ground underneath and the community at large. And those solar panels, they power the normal operations of that center and emergency service. And that is especially important, of course, if there is a power outage, from any kind of extreme weather event, whether that's extreme heat or it could be flooding, tornadoes, you know, we don't have earthquakes in Kentucky, hopefully for a long time, but things like that as well. And that was a project that was achieved by a variety of kind of combining all these multiple grants and tax credits and incentives that we will kind of touch on later in the presentation as far as what's available. And w there are tons of examples of these around the country. Another that comes to mind is there's a community healthcare center in New Orleans called Crescent Care, in a low-income neighborhood, which has been, thanks to some of the funding from the bipartisan infrastructure law, the Inflation Reduction Act, they were able to put some solar panels and backup batteries on this community health center, not only for cost savings for the building and energy generation, but also to have it as a resilience hub because, of course, New Orleans is subject to pretty extreme weather events due to hurricanes. So then, in those moments when there is a hurricane, that Crescent Care can continue to generate energy, to be a place where people can come for food, for water, for electricity, and just to kind of meet their basic needs in those moments. Now, this example on the right here, the Reading Healthplex in Reading, Pennsylvania, is this massive green roof project, uh, where, as you can see, the sort of the walk up to the building was transformed into this green space that's sort of graded, and there are all these walking trails and gardens, and there's the surgery wing underneath. So what this does is not only does it green this approach and create this sort of space that can be used by the hospital, but can also be, used to sort of a pass through, sort of almost like a park space for local residents. Um, and you can look at some of these other links that really kind of get into the details of this project in particular, but it was designed with this idea of how does this react with the local landscape as far as thinking about when it storms and what happens to the rain. So this was specifically designed with plants and different interventions to sort of manage the stormwater, to manage the runoff, to store some of that stuff, and to clean some of those water sources as well. So you kind of have this piece that serves to beautify and to also help reduce heat impacts and provide some of those kind of nature-based solutions for people who might be staying at the hospital while also managing some local infrastructure needs as it relates to water. Now, here we have two examples from the Boston Medical Center. And I also just want to say that I recognize some of these things are very big projects that you might be thinking, holy cow, how could we ever afford that or do that? And I hope that by kind of providing a mix of urban and rural examples in here, it can give a good idea of what's possible in different sizes of communities. So here at the Boston Medical Center, they identified food and housing insecurity as two of the biggest sort of social issues impacting residents. So they started to rethink their approach, that they are not just a they are not just a place that provides hospital visits, healthcare to the community, but that they are sort of a beacon of community health, of resilience, and that they serve a larger role in sort of advocating and pushing for Boston to be a healthy city. So this example on the left, the Clean Power Prescription Program, uh, targeting this idea of housing affordability, they the Boston Medical Center equipped itself with solar panels on the roof, on the carports, on the parking lots, like we just mentioned. Um, but this program essentially, if there are patients who have a difficult time paying their energy bills, they can get a prescription to use some of the energy that is produced by the Boston Medical Center. So this can lead to, hundreds of dollars of savings a month for low-income families, for money that can then be used in other places, to hopefully help them to get a leg up in whether that is getting good food or perhaps buying a car or any of these sorts of things that, require a lot of money. And then to tackle the food insecurity issue, the Boston Medical Center started this really great community garden program. Unfortunately, this uh, picture is a little pixelated and hard to tell, but these are kind of like milk crates that have been converted into planters. Um, so this is sort of a mix of gardens on site, gardens elsewhere, and the Nourishing Our Community program kind of seeks to tackle that food issue by a prescription-based model. And that model at the time of this case study was serving around 7,000 residents and family. And as you see here, they have around 3,000 square feet of farm. And so not only is there sort of the food prescription piece, but there's also a teaching kitchen on site at the medical center that serves the hospital. So the hospital gets access to more clean food, but it also serves the community as well. So community members can come in, they can take cooking classes, they can learn how to how to create and cook really great recipes with some of the foods that they're getting from the prescription program. And that's also available to employees of the hospital as well. And within this whole framework, the hospital also started to think about how they can move beyond this and sponsored at least 12 additional projects and expanded their givings and offerings beyond the hospital. One that sort of ties directly into this is a loan that was made to the Nubian Square Market Community Grocery. So in a food insecure area, the hospital gave this loan to start a community grocery, and also kind of utilizing some of the food from this market. And this was a partnership between the medical center and some local food nonprofits and neighborhood activists. So kind of really, as they were looking at these issues in communities in Boston rather, they were also thinking about who are the people already working in that space? How can we partner with them to, have their expertise, to have the connections that they already have cultivated, and to just sort of really build something from that. And a couple more here as we get back to that idea of nature-based solutions. Not only are those effective, in outdoor spaces, but they can also be really effective indoors in hospitals. So, multiple cases here of hospitals incorporating indoor gardens and sort of these indoor forest models. Uh, and not only are they really beautiful spaces that liven up buildings, but they can also be used for programming. So things like art therapy for folks who are in the hospital at the moment, um, and of course, art therapy and other programs have been shown to improve like some of the hand-eye coordination, the motor functions, cognitive conditions, but also being in art therapy classes together, improving the social conditions for folks who might be in a hospital for an extended period of time and may really, be suffering from a bit of depression or loneliness, as they might, feel a little cooped up. And also, of course, generally, once again, the greenery, reducing overall anxiety, agitation, not only for folks in the hospital, but for the employees as well. In one of these case studies, you'll see an example of where one of these hospitals, I think this was in somewhere in England, they had put napping pods for the employees into the garden. So employees could, during a long shift or after a long shift they could go into a pod on a break and take a little nap, and have this sort of this quiet time. And also a lot of these are designed rather with space where wheelchairs can get through and also where beds can be wheeled out. So sort of specific nooks where, if possible, a patient may just be able to come in their bed and sit for a while, as opposed to just being in their room. So a lot of spaces also are kind of um, looking to their own services as far as how to reduce cost. Um, You can see in this little graph over here, uh, or this circular kind of graphic, uh, some savings from a particular hospital when they started thinking about their ideas of conservation, and waste as it related to energy, but also to the products they were buying and using. And I recognize that this piece might feel a little more daunting just based upon a lot of the regulations that healthcare facilities have to go through with the ways that they use and discard of items. But in these case studies, you'll kind of see a lot of not only examples, but sort of step-by-step guides for how places are rethinking their use strategies. So in a lot of these, folks are able to, as you can tell, once again by the graphic, to reduce the amount of money that they're spending on constantly throwing things out, not being able to reuse things, uh, some of their administration fees, the ways that they're managing gases and fluids, and uh, what simple switches in not only the types of, maybe anesthesia that they're using, but also the way that those things are delivered to patients as well. Uh, and how those can equate to monetary savings on the items themselves, but also as it relates to energy impacts, and whether that is from the buildings and facilities themselves or the supply chain that is bringing those things in and is kind of contributing to these larger, not only monetary costs, but uh, more greenhouse gas in the atmosphere. And I think what was really interesting to me in a lot of these case studies here that you can look at, uh, the hospitals that did these things were largely reporting, you know, annual savings in the 5 and 6 figure ranges, depending on the interventions they were doing. So some hospitals were looking at hundreds of thousands of dollars a year in savings by incorporating some of these interventions. Now, you might be thinking, my goodness, this is a lot of information. How do I even know what might impact my community? I'm going to share with you now a few screening tools that you might use to kind of start to dig into some of these ideas and start to figure out, what are the areas that you might like to work in to impact. Um, and some of these tools also are used when applying for funding and can be really helpful for grants to illustrate, you know, what you're trying to do through some raw data and visualization. So the first of these screening tools is called EJ Screen. And as you can see, hopefully can see, I recognize on some screens these graphics might be a little small and hard to make out. So my apologies for that. But here you can see that they're I also want to say I don't mean to pick on Richmond or any other community that is listed in these. It was just sort of where I clicked. Uh, but you can see sort of the burden, some of the environmental burdens that you can choose from over here, as well as the socioeconomic indicators, getting back to the social determinants of health. And in the second slide, seeing the toxic releases to air in the region, you can really start to see how these things can stack. So in the Richmond slide one, you can see I have all I have schools, hospitals, public housing, all selected to display on the map, and then have toxic releases to air displayed. So you can kind of see how these toxic releases and these, you know, lower air quality is impacting quite a few schools and public housing. And I think there's like one or two hospitals in there in that red area where it is, the most prevalent. And then on that third slide, you can see this slice here has the highest rate of asthma within that. So once we start to stack these things visually, we can start to really tell a story of that there are these things in this area being exposed to toxic releases to the air is causing an increased amount of asthma. So a really good kind of storytelling tool in that way. And you can also create these really great reports from EJ Screen, which I would be happy to walk y'all through if you want to ever use this tool. That gives you these really great graphs, comparative levels of how the local levels compare to the state and the national levels, the demographic information, and then as you can see on the right, the ways that, really drawing out some of the socioeconomic pieces of low income communities and how they might be affected by these particular issues and impacts. Another one to use is the climate and environmental justice screening tool. This one can sort of just easily mention if, as you can see here, whether a community is considered disadvantaged or not, which is considered disadvantaged when it sort of meets these various thresholds of socioeconomic burden mixed with environmental or, energy burden, or other pieces that we talked about earlier within the social determinants of health. Um, So it easily identifies that when you click on the zip code, and you may be wondering why that is important. And a lot of the sort of the current funding that's out uh, encourages communities with those impacts to apply, and that they will sort of be given preference if you are in a disadvantaged community. So over here, you can sort of see on the second slide some of these projected and current rates in this particular um, census tract, which this is not Richmond. I can't remember where this is, but you can see what high percentile all these health impacts are over here, as well as the low income and some of these other projected risks over here as far as environment and some economic impacts as well. So also just a really great tool to kind of to illustrate some of this stuff. Now, this tool from the CDC and the ATSDR uh, is also just phenomenal. This actually was not working for me for a couple days, and then this morning I noticed they had like updated it today. So this is like a brand new system that they put in. It's incredibly robust. I clicked just randomly this census tract down in Logan County. And you can kind of see based on some of these pieces, like I put in childcare centers, clinics, hospitals, and you can see in this particular census tract, there are no hospitals or clinics. And you can kind of get the geographic or the an illustration of how people have to travel geographically to access healthcare in this area. And then some of the burdens over here, the levels. And anything on this map with a score greater than 0.75 is considered a high prevalence and a high burden area. So I think, based on my time with this tool, it is the most robust out of all of them. Would definitely recommend checking that out. And then this one is just a collection of data from the Kentucky Department for Public Health. And as you can see, this is a very hyper-local, state-based illustration of what's going on in community. So you can see all these different areas here where you can really start to dig in to very specific data sets and numbers for the areas in which you live. So, a lot of information. And as we start to think about next steps in this, I think it's important to consider that we start to rethink our roles broadly and how all these things kind of connect together, like in the Boston Medical Center, and how, you know, hospitals can grow their services and what they do and provide to serve different areas and partner with different organizations. And it's definitely a lot of work up front, and it's a lot of unfamiliar territory. But I do think that the little extra effort up front is going to mean extra savings in the long term, and not only savings for the healthcare industry in general, but savings for the community. Healthier communities, we all know they face less burden, less cost, and whether that's health as in actual human health or economic health. So I think also as we think about this, thinking about that idea that issues of capacity can be opportunities for partnerships. So as you might think, we don't have the capacity to work with to do community gardens and rework our food system. And obviously this stuff looks different everywhere, and there are different organizations available everywhere. But, could be worth exploring who are the people working locally and regionally in some of these areas. And how might you be able to partner, to go after grant money, to go after sponsorships from funders around the state. And, also the idea of creating inventories and plans for some of these things. So, Practice Green Health has a lot of really great guides and toolkits that are kind of linked throughout this entire thing and are really great places to kind of guide your initial steps and how do you think, like how to think as far as moving forward in these things and what those first steps are even. I also want to point you towards the Owensboro Health Needs Assessment, which are completed, I believe, every 3 years, and sort of just really illustrate what the needs are of the communities that Owensboro is serving, and those can be used to sort of shape their programming and how they are meeting the community moving forward. So I definitely recommend checking those out as far as like really cool guides of how to move forward. There's also, developing a climate resilience plan. A lot of communities are developing community-wide resilience plans, but we're also seeing a movement of industry in general, of healthcare facilities developing these plans as well, as far as how they meet some of these things. And then, back to this health needs assessment part, partner and listen in your community. Hold community listening sessions, ask people what their concerns are. We at CEDIK are going to be starting some environmental community conversations next year, hopefully in various communities throughout the state. Um, if that's something you're interested in, please reach out. Once again, it could be an issue of capacity, and we'll try our best. Um, but yeah, we're going to be going out, talking to people. What are the environmental issues that are impacting you? What are the industry issues? How do all these things kind of intersect with the environmental issues and how that sort of compares against some of the data and the social pieces? that your community might be dealing with. And also, I'm curious just to learn what you would like to learn more about. What are your own ideas for your community? And what about this kind of feels the most difficult, the most daunting, you know? And yeah, I would just love to hear that. So anything that you want, please use the Q&A tab for your questions too. I would love to hear those, even if they're not questions and they're just reflections at this point. Please put them in there. So here is kind of a list. These are all hyperlinked for you for your use and reference. A lot of the agency grant pages and department grant pages are listed here. This top one up here, the Office of Climate Change and Health Equity Quick Finder, highly recommend this because it gives an extensive list of grants and tax incentives and other incentives that healthcare facilities specifically have used to implement some of these things. I will say a lot of those are Inflation Reduction Act funding. A fair, probably half are Inflation Reduction Act. In all likelihood, that funding, is probably going to go away. But some of those tax breaks might remain in place and can give you a good idea of how to think and proceed forward in the space while they're still in effect. And then, of course, in all likelihood, y'all have already have accounts on grants.gov or you have a sam.gov unique identifier number if you're dealing with the federal government. But be sure to get those if you're going to apply for federal funding. And also be sure to apply through the grants.gov workspace. We heard a story recently about a community applied for some funding who did not use the workspace and their application was not even read. So you have to be sure to use that workspace. These are pieces that I am happy to help you sort through. If you've never used them before, please just shoot me an email. And I think these hyperlinks will work in the PowerPoint. These should each link to PDFs that kind of walk you through um, the processes of grants and sam.gov. Incredibly helpful. And this is just a long list of resources, articles, one-pagers, Health and Human Services webinar series that talks a lot about some of these environmental uh, approaches and interventions that healthcare facilities are taking. So please dig into these webinars, these case studies, these resources. They're very interesting. And contact me. Feel free to reach out with any questions. So we have about 8 minutes left, and I am happy to sort of take any questions you have, to sort of have any kind of discussion about any ideas that are coming up that you're, just a little that you're curious about. Once again, please, put those in the Q&A if you have any questions. And if not, if none are coming up now, but they come up when you revisit the webinar, revisit the slide deck, please feel free to just email me here at this email address, tyler.mcdaniel@uky.edu. Okay, well, I'm seeing no questions coming in, so I think to close, I will say I know this is a lot of information, and some of it might be really daunting and thinking about cost uh, and new ideas and new partnerships and all that kind of stuff. And that is totally natural and anticipated with this amount of information. But I just want to once again say, please feel free to reach out to me if there's a part of this that you're interested in. Um, and it's just even intriguing to you and you'd like to kind of talk through a little bit more and just have a sounding board, I'm happy to do that and to be that sounding board, to try to provide additional resources, to try to connect you with other folks and other institutions. So please feel free to reach out to me. And having said that, and with no other questions, I'm going to give y'all 6 minutes of your day back. So Thank you so much for coming today, for attending. Please keep an eye on your email, and I'll be sending out some follow-ups with the webinar, with the slide deck, and seeking some feedback from y'all. Thanks so much, and I can't wait to hear from you soon.